I'm curious, based on what you see coming in the next 4 years, how does the role of staffing play in the conversations we'll be having? And I'll come to you first, Sonia.
Yeah, I think it's really interesting to think about. And just for the context, right, we're looking at a physician shortage of almost 65,000 physicians by the end of this year, over 300,000 registered nurses shortage at the end of this year, and 60% of clinicians say that they want a different job. I think the reality is that there's no short-term fix here. We talked a little bit about technology and other things that can help extend and really think again, I think frankly, about the workflow of how we do care delivery and also the patient interactions and what that looks like. I think the longer point is that we actually need to have a change in our education system that allows for a different way for us to bring providers into the system and educate them, and to think more about alternative providers or community health workers or other parts of the ecosystem that can help play a role in actually bringing care delivery into particularly areas that are shortages. So we need to really think about sustainable solutions there. I think the other thing to think about is just immigration. As you start to think about the issues around immigration, and we know that 25% of the physician workforce are immigrants that are in graduate school that have come here. So how do we think about that as we think about the context of immigration, as well as the impact on staffing within the healthcare system? I think there's a really big connection there that we need to think about as particularly with the Trump administration and the views that they put forward and what that looks like.
And I'm glad you raised that about immigration, Sonia, because I think this subject has to take us to that discussion, because there are so many opportunities to ease the shortages, to bring in very well-trained, very capable people, if we can allow it to happen. So I think that's going to be a key part. And as well as from a regulatory point of view, allowing less educated, degreed, if you will, however you want to call it, to do more in the system more cost effectively.
I don't have much to add. Yeah, on the macro side, the policies of this new administration seem expansionary, so there'll be greater, job opportunities. We have low level of unemployment. There'll be less people coming and less immigrants, and higher tariffs, so greater production here. So, the staffing issues are going to really intensify if any of those statements around future policies actually get implemented.